Hi, I'm Sophie, nurse practitioner at Turner Medical Arts. These short episodes are all about real women's health and my clinical experience and knowledge. This is a channel where I talk about all things hormones, perimenopause, sexual wellness, birth control, weight support, and everything explained simply without the confusion. Let's dive in. Hi, I'm Sophie, nurse practitioner, and today I'm going to be talking about how somebody should be choosing their birth control. So it can feel overwhelming when you come into a practice and you see all of the different potential options for a birth control. So it's so different for every single patient as to what would be the best fit for them. But a couple things that could maybe get you going. And when you start thinking about what you want in a birth control, here's a couple things. The first is really whether or not you have really heavy or uncomfortable periods. Some people really start birth control not only to prevent pregnancy, but also to help manage their periods. So some of those could be an oral contraceptive where you're not having a period for 3 months at a time, or sometimes people actually want their period once a month, but because you're on birth control, it's a little bit more controlled. The other types of birth control for someone who wants to prevent a period could be an IUD or even an arm implant. Other things that you can do are skipping your periods. You can do that with the ring, where you exchange the ring after the 3 weeks and put in a new one. Or you can even skip your sugar pills on the combination patches. Other things to think about for birth control are really whether or not you remember to take something every day. I always say the pill works if you're taking it. A lot of times that can really be something that prevents people from it being a really great option. If you're someone who's pretty forgetful, my usual recommendation is maybe to consider something that's more long term that you can do once and you can forget about. So there's so many options. Periods don't have to be painful, especially if you're having super long and really intolerable periods. I'd love to chat and feel free to come into the practice and we can discuss what a good plan for you could be.